From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. We all have that one thing we'd love to fix about our smile, whether it's a gap, a chip, or stubborn stains. Veneers could be the solution, but how do you know if they're the right choice for you? Today, we're answering your biggest veneer questions with the amazing Dr. Justin Griffin. Dr. Griffin is the top cosmetic dentist in Columbia, South Carolina. People traveled to his office from around the country for their smile transformations. He's also a social media influencer known as the Smile Doc. You can find him on TikTok at smile_doc or on Instagram at RealSmileDoc. He's all about sharing tips that make dental content both informative and entertaining. His motto is to help people smile on the inside and the outside. Dr. Griffin, welcome to the Care Experts podcast. We're so thrilled to have you here today to dive into the world of veneers.
Thank you. Happy to be here. I've done a few of them.
You have done a few of them. You have this incredible following on social media, and I can only imagine people who are fascinated in the before and after photos of veneers. Veneers are everywhere right now, especially in media and celebrity culture. And then, of course, that trickles down into the general public. Mm-hmm. I know so many people who more recently have gotten veneers at a younger age than what maybe would have been normal 10, 20 years ago. Are you seeing that in your clinic as well?
Yes. There's different types of veneers, but mostly generally when you and I talk about veneers, mm-hmm. I'm thinking about porcelain veneers, just so you know. But yes, I see younger people do it, and I'm sure it's because of, Selena Gomez got them or they see it on social media, and that sort of gives them, permission to do it at a younger age.
What is a veneer?
A veneer is in this context, it's a thin piece of porcelain mm-hmm. that you can put over your teeth permanently, and it'll fix blemishes, chips, cracks, rotations, spaces, so you can go from a smile that's got some distractions in it mm-hmm. to one that is harmonious in one procedure.
If we're talking about our harmonious smile, or what one would typically say is a beautiful smile, describe that to me.
So you want things to be symmetric.
Yes.
Symmetry is beauty. We like things to be angled just right, not chiclet. The chiclet look comes from like being straight. But,
what is that chiclet look? Is it that the teeth are too flat? There's not enough rounding happening, or
on the edges, they're usually not enough rounding. They're also they come to the same length.
Yes,
and their angles are straight rather than angled. The tooth angles should go towards the belly button. So the front two like this, the side two, the canines. Okay. So you want that kind of going. The gums. Also, there's some symmetry and some a design to how the gums look. So there's the color, the shape, the angulations. Of course, the lips play a role, and there's lots of things that go into a good-looking smile. But it's possible to get them looking very natural.
Yes, I think it's important to note for anybody who's listening, smiles can look beautiful with imperfections as well, and without it being perfect. Even when you said it should be symmetrical, you kind of did it in quotation marks, in that we can have some asymmetry in our smile, and it doesn't mean our smile's wrong or anything like that. But if we're talking about what would be considered a perfect smile,
if you expand it to your face, generally the face is symmetric. But if you take a picture and you start analyzing, you'll see one nostril's off, perhaps the tip of the nose is off, one eye is lower. There are asymmetries in the face, and that's the natural nuance that is beautiful. Mm-hmm. If things were perfectly symmetric, like literally a mirror image, it might actually look off.
Would you say that most people who are coming to get veneers are doing it for an aesthetic purpose?
I can't tell you how many appointments where patients show up for a veneer consult and they leave for clear aligner impressions or scans. Or they come in, they want braces, and they actually are going to end up getting some veneers.
Right.
Because my goal is, what are the chief issues you have? What is the least expensive, best way, longest lasting way to get you to the goal that you have?
And I do want to say that there's nothing wrong with getting an upgrade to your smile for aesthetic reasons. We are forward-facing humans who see other people, and you want to feel confident in your smile.
There are studies that show your smile is the first thing that people look at. I mean, it's what may get you a job or not get you a job, or a relationship or not a relationship. I mean, people are like, the smile.
Yeah, really allows them to show up fully for life. So there's different types of veneers. I've heard you say porcelain veneers. I've heard of no prep veneers. What's the difference between those two?
Generally, the two types of veneers are porcelain or composite resin. Okay. Now, the prep part is how much prep do you do? You can have no prep or prep porcelain veneers, and you can have no prep or prep composite veneers.
I gotcha.
What's really buzzing right now are minimal prep veneers, which are minimal prep porcelain veneers.
Okay.
So if they do composite, and we can talk about the difference in composite and porcelain, but if you do, composite is generally less invasive or less prep generally. Porcelain is usually more prep, but there are ways now, really over the last 5-10 years, where you can do minimally prepped porcelain veneers, which is big, because a lot of resistance to veneers is, I don't want you shaving down my teeth to baby shark teeth. You know, that's what they see, these Google images, and they're like, no way. But so traditionally, when we were taught how to do veneers, which was not in dental school, by the way, but in your postdoc education, if you go back 15 years, you're taught how to prep all the teeth.
Yes.
And nowadays, all the teeth don't have to be prepped the same way. That's the important thing. Some teeth need a little prep. Some teeth need a traditional prep. Some teeth need zero prep. I've got smiles. I got before and after pictures I can show you. Zero prep, zero anesthesia.
Wow.
Veneers. Yeah, I mean, it's amazing. We just seeded a case, and we do it a lot more now because we understand the process a little bit better. But you don't have to always prep for veneers, but it's important that the cosmetic dentist understand that and only prep where the prep is needed.
Can you tell us a little bit about the difference between porcelain and composite?
Sure. It's a very popular subject, covered in almost every consult. So with porcelain veneers, generally they will last longer. Generally, their color's stable, so they won't stain over time. They're more expensive, and they take a little bit longer to make. Okay? With composite, they are not color stable. They are cheaper. They typically are not as strong. That doesn't mean that they can't last a long time, but a lot of dentists will use them when they're not indicated. That's why they chip. So if you know when to use them, they can last a long, long time. And typically for teenagers, we're going to do our best just to use composite, because teeth are still growing and stuff. They can always grow up and move into porcelain. Okay.
What is the difference between a veneer and a crown?
Okay, so a veneer is more like the face, like what you see. And then a crown is like 360-degree preparation on a tooth. So it's like a cap.
And it is going around the tooth, whereas a veneer is sticking on the front of a tooth.
Yeah. But there are also things that are in between. Some cases will have no prep veneers and a crown in the same smile.
Right.
And when they're smiling, it just looks like veneers. But we just say veneers loosely.
Right.
You do my philosophy is you do the minimum amount of prep for the maximum amount of strength and beauty. And so patients are like, are you going to have to prep my teeth? I'm like, well, I got to prep that one because you've got this decay on it. This one here, I won't have to prep at all. So we're going to prep where we need to only. We're not going to touch any of the enamel that we don't need to.
Okay, amazing. So if somebody's listening and they're like, I've been thinking about getting veneers for a long time. I have a greater understanding now of the different options that are available to me. But they're worried about going in and having that chiclet look where it's really obvious that you've got veneers.
Yeah.
How do you pick a dentist to do this work?
Love this question. It doesn't just have to be veneers. Like, I'll give this advice to every patient. For any case, if you got to get an implant done on a front tooth or you got to get a bridge for some reason, like your dentist should have some before and after pictures of that very case.
Right.
So you can see what it's going to look like, and then take a picture of it, and just take it home and think about it. But Yeah, you'll know. And if they don't have any pictures, that may be like, okay, well, maybe I'll get another opinion.
Yes. Can you tell us a little bit more about the process of getting veneers from that initial appointment to leaving with your brand new smile?
Generally, it takes 2 to 3 months, start to finish.
Okay.
Okay. And I'll try to break down what happens in that 2 to 3 months. So the first appointment, the consult, and that includes like an exam.
Yes.
So as I talk about this, we're just going to assume an exam has been done. The teeth and the gums are healthy. They can support veneers. Okay. Yeah. All right. So you do a smile consult where we talk about everything. We zoom out, look at the whole face. We look at the midline, not just the upper midline, but we're not looking for where it is. We're looking to see if it's canted, how it lines up with the bottom one, all of that. We start looking at the crowding, the spacing, the chips, the length, the gum height. Believe me, there are times when patients will say, well, I show too much gums over here. So, okay, well, maybe we could do some gum contouring.
Yes.
But you have to look at everything. So perhaps it's a lip asymmetry problem and not a gum asymmetry problem. It's just something to think about. So you could do a little Botox up here, relax the lip. I mean, there are things you can do to solve the problem, but you don't want teeth really tall on this side and low on this side just so the lip is touching the top of the teeth. You know what I mean?
Right. Absolutely.
So you talk about all that in the smile consult. You got to understand your midlines aren't going to line up, or, if you want the midline shifted, we have to prep more, that kind of conversation. Okay. We talk about the smile style, and we also talk about moving forward, what happens. So if they want to, let's say they're not veneering every tooth, they might want to whiten some teeth. All of this is talked about in this first consult. Okay.
Yes.
All right. So let's say they need the works. They need a little bit of gum contouring to make things more symmetric, and they're going to whiten, and then they're going to get veneers. Okay, how does that look? When they say go, we do a scan. We used to do impressions, or some dentists that still do it. A lot of dentists are now doing scans. So we'll scan the teeth. If they're getting the gum contouring, that's where you'd start.
Okay.
So we do lots of photos, a huge photo session. The face, smiles, retracted, everything. Lots and lots of photos. Then we do the gum contouring. If we have to use a laser to get things leveled up, but we get things leveled up with the gums, and then we scan the teeth. So we get the scans, we get models for 2 reasons: for the bleach trays and for the wax up. And then we talk about a smile style. And they don't have to use the smiles that we have. They can bring in a picture of Halle Berry or someone that they really like their smile. If it's a good, clean picture of the smile, maybe it's their smile when they were 20 and they've got a really clear picture, we can get really close to that. So they'll pick out the smile style, and then they'll go home and they'll start bleaching their teeth.
Why are we bleaching our teeth before we put a cover on them?
If they're not veneering all of their teeth. So maybe they're only doing the canine to canine, and they still got these bicuspids that are going to be in their smile, and they want to get them a little bit whiter. They're going to whiten everything else, will match the veneers to the new white color. Or they're not doing the bottom teeth. So maybe they're just whitening the bottom teeth.
Yes.
But you won't whiten the teeth that you're going to be veneering.
Okay. Gotcha.
Good question. When they're whitening at home, waiting for their second appointment, which is about 3 or 4 weeks away, that's when I get involved with the ceramist. And I tell the ceramist, I send them the models, send them all the pictures, and I say, this is the smile style that they want. We call it a wax up because it used to literally be done with wax. Now it's done digitally, and then it's printed, but we still call it a wax up. And so they basically take the models and they do whatever preps need to be done on the models, and they rebuild those teeth in the style that they chose. So now we have a before model, and we have a wax up model of the new smile where we're heading. You got it?
I got it. I am with you.
All right. Appointment number 2 comes. They're done whitening, and then we prep the teeth. That's when, if you have to get numb, that's the appointment. This is the day the work gets done. We start doing the work. If you have to get numb, you get numb on this appointment. And we do whatever preparations, minimal preparations are needed. And then we do a scan of those preparations. Then we make temporaries off of this wax up. So that day you have temporaries, and they can look amazing. Temporaries don't have to look bad. They used to look bad.
Yes.
And now a good cosmetic dentist can make temporaries look like the final product. No joke.
Even the color, so you're starting to see whether or not the color feels right.
Yep.
The bite, is the bite going to feel?
We make the temporaries off of this wax up, and then we adjust the bite, make sure the bite is dialed in, and then it's the big reveal. That's when they get to see their new smile. And this is the biggest, like, oh my gosh, appointment. It's not when they get the finals, because the finals should look like
exactly
the temporaries.
The same. Yes.
So it's not as big of a like bang when they get their finals.
Yeah.
Now, finals are better, but it's this appointment where they get to, like, this is when we see tears and hugs, because it's like, what a change. The space is gone. The discolorations are gone. My teeth are whiter. They're straight. They're harmonious. We use this word. Now they go home with these temporaries. Over the next few days, the patient is evaluating the color of these temporaries. Yeah. They're evaluating the shape, the size, the length. Are they too pointy? Are they too round, too square? And we can make these changes right on the temporaries in their mouth. And so we make the changes till they give us 2 thumbs up. Then we take new pictures. We do a scan of these temps in their mouth. So we now have a model of what they love, which we send to the ceramist. And the ceramist makes the finals now based off of these modified temporaries, if they're modified.
Yes.
So now we know that the finals should look very similar to the temporaries. They can't be identical. They're handmade.
Right.
Okay. But they're going to look really close. So if you had the pointier canines, you're going to get pointier canines. If you thought the temporaries were too white, we'll dim them down a little bit. And so then the finals come back in the right shade, in the right shape, and we're ready for the final appointment. If you had to get numb at the second appointment, you'll probably have to get numb at the third appointment.
Right.
So we get those teeth numb, we take the temporaries off, we try in all of the permanent ones, and then we give you a mirror.
Oh.
And that's when you're like, wow, and they do look better. The temporaries, although they're a nice color and a nice shape, they don't feel like teeth. They're a little rough. You can't floss between them. I mean, the finals are going to be textured.
Right.
There's going to have lobing. There's going to be a color gradient. There's going to be translucency at the end. These are going to look like
little pieces of porcelain art in your mouth.
Like they were born there. So they try these in, and now these are just ultra glossy. They're reflecting light much more naturally. And they're like, oh my gosh, yes, I love these things.
Wow.
Then you bond them in, check the bite and all that stuff. We always recommend a night guard for people afterwards. It's just safe. If you have an issue with the temporaries, hopefully the finals are going to look just like the temporaries. Right. So you will be disappointed.
Right.
You're going to be frustrated with the color, and you're going to wish they were whiter or something else, and you need to speak up. I can tell you, if you wait until after the permanents are put on, it is a nightmare. It's doable. It's fixable. And I just replace the veneer. I would just replace it. I would, as a provider. So please use your voice when you have the opportunity. It's best to speak up when you're in the temporaries.
So what is typical? 6 teeth across the front? Or, I mean, it obviously depends on the situation.
Yeah. So what I tell patients, if they're wanting to make a change, you got to do every tooth you see.
Okay.
So when you smile real big, some people see 8 teeth, some people see 10, some people see more. And then they'll do the bottom if they want, or they'll do it later, But so I give them a mirror, and I'm like, how many teeth do you see? And I'm like, oh yeah, I see 8, 6, 8. So you see 10 teeth. Yeah. So if you want a new smile, you need to do 10.
We need to do 10 teeth.
But you may, if the back 2 are like in alignment, they look good and they're healthy.
Yes.
I might say, you could get away with doing 6.
Right.
But let's whiten those other ones.
Okay. We have some amazing questions from our audience that I'd love to ask you for our Ask Me Anything segment. The first one is, I drink 2 to 4 cups of black coffee a day, and lately I've noticed my teeth aren't as white as they used to be. I'm wondering whether I should whiten them or just go for veneers.
On the day-to-day, if you drink a lot of red wine, chew tobacco or smoke, whatever, veneers can pick up stain. So a veneer is not going to be the cure for coffee stains.
Okay.
Veneers can pick up stain, but those stains are removable even when you get your cleaning, or you could whiten them, but then all you're doing is bleaching the stain.
Right.
You want to get them clean.
Right.
So most of the time that can be fixed when you go get a hygiene visit.
The next one is, I heard you can get veneers in colors other than white, like gold or black. Is that true?
I'm sure you could. I'm sure you could. I mean, I've seen crowns with like Clemson paws in them. You can do just about anything.
Wow.
So I haven't seen black veneers.
You haven't personally done it yourself
No.
or
And you
put it
gold,
in
you can
anyone's
get
mouth?
gold anything.
You sure can. All right. And the last question. I chipped a tooth about 6 years ago, and at the time they offered me bonding or veneers. I couldn't commit to veneers at the time, and I went with the bonding, but now I'm thinking about it again. Is a veneer still an option for me?
Sure.
Yeah.
Yeah. If the bonding worked, you may want to stick with the bonding. It's just less invasive. It's a lot cheaper. If the bonding is starting to chip a lot, you may want to consider something else, but it won't, again, let's go back to why is it chipping? If I put porcelain on there and you've got teeth on the bottom that aren't working harmoniously,
right,
you're going to chip the porcelain. So you got to figure out why is it chipping? One of the disadvantages to composite is it's not color stable. It will dull in color and over time. Like one of those, whenever I'm talking to patients about it, I think about a clear phone case. If you ever bought a clear phone case, after a year, it's a little yellower.
Yes.
It composite will do that. It's plastic.
Okay.
So what's wrong with the composite? That's my question for this person. What's wrong with it? Are you just thinking you've had to replace it a bunch of times and you don't want to do that anymore? You want something more color stable? Then go with the veneer.
Amazing. Thank you so much for joining us and sharing such great information.
There's
I feel
a
like this is a conversation that there is just so much to talk about, and it's so interesting. It's really important for anyone considering veneers to get as much information as possible.
I agree.
And so really appreciate you walking us through the procedure from start to finish.
Glad to be able to do it for you. Again, it's a long conversation, lots more, and I bet you could have 50 more questions in 30 minutes. So I hope it was helpful.
Head on over and follow Dr. Griffin on Instagram and TikTok, and
Thank you.
You can find more information there.
They got veneer videos too on YouTube. Like there's plenty of information out there.
Amazing. Thanks so much.
You're welcome.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.